Again, my name is Jacques Stroud, and I have a digital healthcare company. We're addressing communities, healthcare outcomes for impoverished communities. But we're recently working on a device to address the mental health, onslaught that's coming or that is here now. Before, we worked with a lot of homeless individuals on a grant-funded project to address the inefficiencies in healthcare towards impoverished communities, the homeless communities, and their families. From that, we learned that mental health is a big component of the outcome of that family, which became homeless. From there, we want to address the concerns that mental health was a contributing factor to someone being homeless, along with other factors. From that led me to Cornell University to create a grant-funded program to create a device to help towards that. That's when I did my customer discoveries and talked with students and professionals, and this is some of the responses I received from doing customer discovery. With mental health, it affects people in the workforce, but also children and young adults in the classroom. We discovered that there's a big cost to that financially for companies, but for students and young adults, it's a cost of education and learning that is helpful in the classroom for them to succeed in life. We wonder, and a lot of people wonder, why these individuals don't go to seek services for mental health treatment. And with that comes the possibility of their illness being discovered from their coworkers or others, students. And with that comes the stigma or the labelization of mental health. And that also can bring about prejudice and ideas about their condition and their ability to work in the workforce or to accomplish tasks. And that's where the Docfully One comes in. A wearable device that's inconspicuous and helps the wearer help manage their triggering events. It's weared underneath the clothes, and it uses technology that we developed at Cornell and software to help the individual manage their anxieties that could lead to depression and other illnesses. Not just hardware, but the software component with it is what we use to help them get back to homeostasis. We are using mobile applications to do a feedback loop of answers and protocols that they developed along with therapists and other professionals to help them put together a protocol for them to actually get back to a state of calm after a triggered event has happened. The way the device works and the way the program works is that we first recognize the triggering event. Just like a blood pressure cuff can help someone recognize if they possibly could have high blood pressure, our device will help them understand if they are suffering from a mental health trauma, that the event that they experienced early on in life. And this way we can help them recognize that yes, they are suffering from anxiety or trauma, and certain events trigger this event to happen, which can debilitate them from doing tasks or learning or getting things accomplished. Where we come in is we want to intervene right as the event is happening and help the person back into recovery by reducing the time it takes for them to come out of their downward slide from being triggered. The market for mental health is just now being recognized by recent events by the Medicare and Medicaid divisions here in the United States, especially after the global pandemic. That's the way that's being recognized as new protocols and procedures and CPT codes for reimbursements have been developed to treat mental health illness and behavioral illnesses. And so the market has expanded from what it was previously before the pandemic. And this is why it's a good opportunity to try to take advantage of this increase in the market size. Our technology is not new. It is being utilized by other organizations and companies, but we are utilizing the technology specifically for mental health and behavioral health, and using this technology to capture a market in healthcare, specifically mental and behavioral health. And we're trying to use it only for that, nothing else. We have on our team a lot of professionals who are familiar with software, data analytics, the in medical insurance department, as well as hardware. So in summary, what do? Docfully is a device that recognizes when someone is triggered to possibly recognize anxiety and prevent a depressive state and to help them achieve more homeostasis. Who is this for? People who feel helpless and without sufficient support to address their mental and behavioral health issues, and also as another means of way to help them manage their condition, as well as medication and therapy. Things we're looking for, along with funding, is expertise in engineering, healthcare, contract manufacturers, therapists, and other professionals. Just more information about the mental health here in the United States. And in future, now it's a wearable device that we wear the shirt, but we want to make it further inconspicuous by having it in another form as a form of a ring. Thank you.
Any questions?
John, right? John?
Jacques.
Jacques. It's fantastic. I'm curious how it works. Does it track your autonomic nervous system response? And so HRV, I'm
Yes.
guessing. And then how does it treat exactly?
So, first we want to recognize when someone's having an event, and we want to be able to decipher if, just like kind of like your Apple Watch when you're exercising, are you having a triggering event or are you exercising? That's the first step in that process. And then we go through a protocol to see if they are in a safe place and in a right state of mind to be able to make decisions to get them back to homeostasis. If all else fails, it triggers a 911 for them to come get help to them. But it's all based on biomarkers. Heart rate variability is one.
And then through the app on the phone, basically.
Yes.
How it, yeah.
Yes, it's a lot of human interaction to create the feedback so that it goes through a certain procedure and protocol that the person, the wearer, helps develop, or the caretaker or the teacher that helps the person, the wearer, to go through protocols to help them get back to homeostasis. And it's not done in just one time because it's a loop, continuous feedback loop. So because that person could be in different situation of triggering events, so the app has to be able to modify to be able to recognize those events.
Sounds like AI would be great.
That's part of it, but we want to first do regular means and then to help with that. Right now, seeking patent approval of a protocol we're using for doctors to be able to use this as well as to use social cues for determination of diagnosis.
I'm curious, you said there's a ring, you want to transition to a ring. Can you get the same biomarkers from?
Same technology as your Apple Watch. We just want to try to make it smaller. And there's ring companies that the same technology. We're just trying to once we can make sure that the procedure is
Like an Aura ring? Cool. Thanks.
Is the device the product or the combination of the device and the software, or can you specifically take your IP within the software that's, determining your heart rate variability and being able to pick up on these biomarkers, is that the actual, product?
That is the actual market, but because we're seeking patent approval, and so that's why the software was first put together when we studied, when we were working with homeless individuals. But because we want to connect it to a device to be able to market it to more individuals, not just, just using the software. The software and the IP, yes, can be transferred over, and that's the core of it. But we want to implement that into our other means of communications to our patients. Again, to telemedicine, what we were doing, in our first project, using it for video conferencing, using kind of like the same technology and IP towards that. But we want to put it in a tangible thing to be able to for more mass production, more mass distribution. Did I answer your question?
Yes, sir.
Any questions online? Any more questions in the room?
I don't know if this works. How many people have tried it?
Any more questions? You have a question? No.
Have you reached out to health community centers where necessarily folks don't have health insurance, and then anywhere in the Midwest as well for rural transformation for behavioral health as far as digital health is concerned?
Haven't reached out to community centers. The original people that we've been working with are schools for young adults who possibly who suffers from this, because we want to try to address it early in their lives and be able to see how well it goes from early childhood, high school, college, and young adults. But then those people who are in rural areas can also benefit from this if they have trouble being in an environment where it's a lot of stress, like a work environment as well. So that is something we can want to consider, because we've been focusing mostly with young adults in school settings.
Any questions online? Thank you very much for taking time today and share with us